Well, France 24's Bénédicte Paviot is in London following developments for us and joins us now. Bénédicte, so the legal requirement for mask wearing in enclosed spaces has been removed. How are people reacting to this new reality?
You're absolutely right. That is the new reality, that wearing a mask in enclosed spaces is no longer a legal requirement, but it is recommended, and there is, quote, an expectation that one will wear one if shops require you, ask you to wear one. Certainly the Mayor of London has made it very clear, and Transport for London, that one must wear a mask in the tube system, for example, on all public transport. And it's interesting because a quick survey across England shows that it seems that the vast majority of people are indeed wearing masks today. This, as you say, so-called Freedom Day. Others have dubbed it Reckless or Anxiety Day because they're worried about people in close proximity, since we also no longer have the social distancing rule of 1 metre or more that is legal requirement as well. So it seems that regional leaders are worried as well. They are requesting that the public wear masks on public transport, and indeed in Manchester, Mayor Andy Burnham is calling for face coverings to remain on the tram network also as part of a condition of carriage.
Right. I mean, part of the concern, of course, and you mentioned the anxiety that people are feeling, as well as the celebration. Let's not forget, a lot of people were lining up outside nightclubs last night. But people are worried, aren't they, that hospitals might go from being in a situation where they are now, where they can manage things as things currently stand. But what will happen in 30 days' time?
Well, that is the big question mark, and the unknown, very clearly. Look, it's very clear that since the beginning of the pandemic over a year ago, the way that the UK government and all four nations have dealt with it is through very tough restrictions. And that word that we've all become so familiar with here in the UK and across the planet, lockdowns. Now, what the British government is relying on, and certainly here in England, as well as in the other nations, is the vaccination program, a very impressive rollout of between 65 to 80% of the adult population having already been vaccinated. And that is indeed world leading. What, alas, is also partly world leading is the record death toll, over 148,000 deaths so far. And so the big question is, when you hear top scientific experts talking about at the moment, we've just gone over 50,000 on Friday and Saturday, new COVID cases a day, but that in the coming month, we could get 100,000 new cases a day, or it could even be double that, 200,000. At the moment, we've got about 60 or so deaths a day. What will happen? For the moment, that link between the actual getting COVID now, and it's mostly the Delta variant here, then you might be hospitalized, but you're much less likely to go to hospital and less likely to die. But, of course, there are many questions about long COVID. So we will hear, interestingly, from the Prime Minister himself, who since Sunday is in self-isolation. He initially didn't really want to do it, but he will be doing a briefing. And I'm sure that the master word that will be coming out of his mouth for the coming hour will be caution, and that is to be cautious. But the big question is the United Kingdom heading for its biggest infection rate? That is possible, and the pressure on the National Health Service could become very great fairly quickly, and that is the big concern for many people.
OK, well, thank you very much indeed for bringing us up to speed. France 24